Hi there. So this exercise is going to stretch all the major extensor muscles down your right hand side, focusing in on some key ones really. It's about activating particular sensory receptors more than it is trying to increase mobility or flexibility on your right. It's actually about getting your left hand side to fire up a little bit more and to balance out the equation. We're going to combine it with your saccades exercise for your left cerebellum as well. So we want to focus on any muscle that extends a joint on your right, and really there's some big key players, and we want to do it sequentially from the ground up. So really we don't need to be too concerned with very much in the lower limb. We're just going to start from hamstrings up. The best way to work on the hamstrings will be in the supine position. Hopefully you can still hear me. Is to just use a towel or your clinic tunic, and you're just going to take your leg up in front of you like so. You can just work on trying to straighten your knee, but it's more the proximal aspect of the hamstrings that we want to stretch. So we're not too worried about bringing on the stretch in this distal aspect. So actually focus on bringing the knee closer to your body and then trying to straighten, rather than having your leg further away and trying to straighten from there. We just want to access that proximal most hamstring insertion as much as possible. And I would recommend for this particular exercise, gentle and slow for up to 15 seconds per stretch. But importantly, when you come out of the stretch, just release really nice and slowly. Don't rush out of a stretch, because there is always the risk that the fascias will sort of reflexively contract in a sense against the stretch. So you just want to stretch into it slowly, hold it for up to 15 seconds and then relax out of it slowly. Starting with that proximal hamstring. Moving from proximal hamstring, I would aim to go into glutes. In fact, we'll just go into gentle stretches of the major glute muscles. You can come right knee across to left shoulder. You can just go knee to chest. If this is all too easy, just relax in this position for a little while, give it your 15 seconds and just move on. In terms of moving on, we're going to go then to your piriformis stretch, and I can show you a separate video on post-isometric relaxation of your piriformis. I'll send that in another link. And the key here is to go through the gap behind the back of the left knee, and then just lever your right elbow into your right thigh, so that you're actually bringing on that rotation, and then gradually bring your foot towards your head, your left foot towards your head. Okay, and again you'd hold that piriformis stretch, or go through the PIR protocol as per the other video for up to 15 seconds, and then you just slowly relax out of it. Okay, now a QL stretch is a little bit more difficult, but that's sort of where we want to go next. If you prefer, you can use my other videos to use the foam roller into your QL and treat it directly with sustained pressure. But one of the best QL stretches I recall from yoga was to be in this wide leg stance, take the elbow of your left arm into the inside leg of your left leg, and then rotate the chest upwards towards the ceiling as best you can, and then take your arm up and over, and to create that side bend that will impact your right quadratus lumborum in your side. Okay, so it's the combination of pushing yourself into that rotated position, or in fact a neutral position, and then going into the lateral flexion with the added support or impetus of this right arm, the weight of this right arm levering you over. Okay, you need to be careful with that one, just because it can be quite intensive on your lower back, which doesn't necessarily laterally flex all that well at the moment. Again, You can do that with the foam roller if you prefer. It doesn't have to be a stretch, it can be sustained pressure via a foam roller. Same goes for rhomboids at the back of the shoulder here, equally as well done with the foam roller, but that's where we're going next. You can just take the arm across the body like so. You can literally just get hold of your shoulder blade and just pull it forward and across the body and over in front, supporting the rest of the arm. In this case, my right arm is supported on my left elbow and otherwise just completely relaxed, feeling quite passive, whilst this left hand does the work of pulling the rhomboid over. You can actually, whilst you're in this position, you can be stretching that, and you can also do a little bit of side bending of the head, a little bit of rotating and side bending. That can sometimes alter the stretch slightly. Moving on from there, we'll go to levator scapula. So that's coming up the back of your neck and also upper traps. So there's a few different ways. One way is to take your right hand behind your back. That's already creating length, and you can just side bend into that upper trapezius. You can rotate your head slightly upwards to get more of a stretch through scalenes and upper trapezius, or you can rotate down to get more of a stretch through levator scapula. Okay. Sometimes you can do that exercise sat on a chair and holding on underneath the chair with that right hand, which just brings the shoulder down, anchors it down so that your head stretches everything else away. Go really gentle with that one as well, because you don't want to upset the apple cart there. The key here is gentle and slow in and out of the stretch. That should cover everything we need to cover in order to successfully reset the gain. That means to down-regulate the right cerebellum through overstimulation of the length receptors, this muscle spindles in the right extensors, and in doing so upregulate the left cerebellum, which will then necessarily output better to your left hand side and balance out this whole equation. So see how you go with that, and let me know if there's any issues. Okay. I will also send over the piriformis PIR and also a strike phase exercise that you can do on your right hand side instead of the hamstring stretch as well. So there are alternatives to each one of these exercises. Okay, thank you.